video. And tonight, folks, we're going to talk about the coronavirus pandemic here in New York affecting the whole world. But today we're going to speak about what's happening here in my local area in the New York City region. I am a retired New York City police detective with 20 plus years in law enforcement in the New York City Police Department. If you're new to my channel, please hit the subscribe button. Hit that notification bell so you will get all things Dutyron when I upload, go live, or send out any type of information throughout my social media networks. Follow me on Twitter, Facebook, Instagram, all one word, Dutyron. Thank you to all my channel members. Thank you to all of my Patreon supporters and everyone who here positively interacts in the live stream. I greatly, greatly appreciate each and every one of you. Tonight, unfortunately, we have a bit of good news and a bit of bad news. Governor Mario Cuomo, who does his daily news briefings, today spoke about a new high in deaths overnight from coronavirus. Close to 800 people here in New York, in the state of New York, passed away from COVID-19, which is a new high, unfortunately. But our hospital cases are slowing. The admissions to the hospital are slowing, and that is a good thing. Hello, Save Robbie. Good to see you. Thanks for joining. Good to have you in on the broadcast. Carla D, Daphne, Diane, Erica Collins, all of my great friends coming on in. Thank you for coming on in. I appreciate you guys. We're going to go over the news conference that was covering all of the media from today. Again, like I said, a new high on the deaths overnight, which is unfortunate. It's been mounting, and I think we were close to 2,000 coronavirus fatalities in a 24-hour period worldwide, which is very, very unfortunate. Hello, Cup of Joe. Thank you for the super sticker, super chat. Appreciate you being in here. Thank you so much, Ginger Locks and everybody. So again, you know, the hospitalizations are slowing here in New York, which is awesome. I love you right back, Carla. Thank you so much. Sophia Howard and Maddie Sully, all the great ones are in here. I appreciate you guys, and I thank you all for coming. If you don't mind, please share it out onto your social media. Send it to Facebook. Send it to your favorite social media platforms, because what I'm about to share with you today, you may not have seen, and it's a lot of valuable information from the state of New York. The state of New York is, as we all know, getting hit the hardest in the United States. But if, God forbid, this comes to you in a larger scale, you can capture information from New York and learn from us, and heed the warnings. Slow and flatten that curve by staying home. Do what is told to you by the CDC. I recommend everybody go to cdc.gov and check out that website. I'll link it in the description down below. Sleeping Beauty, thank you for the super sticker, super chat. #1 fan, Sleeping Beauty, and channel member. Thank you for the super love. Go to valid sources of information. Don't go to hate mongers and people who send out perhaps a negative message that is unverified. Go to people who are going to give you good, valid information. And we all know by washing our hands, by social distancing, and staying at home, it saves lives and it flattens the curve. New York is now in a flatten the curve scenario, which is fantastic. It is fantastic. Great to see you from Florida. Prayers right back to you. Thank you for joining. All right, we're going to jump right into it. And then as soon as this press conference is over, I'll come back on and we'll speak. But I highly, highly, highly recommend each and every one of you. I would tell my family to do this. Go in and definitely listen to what Governor Cuomo says. He has a lot of good information. He goes over a lot of different things. And this information could save lives. And it's important that we get it from valid and good sources. He's a great source of information. He's on top of it. And we have, unfortunately, the most cases here in New York. So lots of our frontline first responders, our healthcare workers, they're all taking the brunt of this for us. So I salute my healthcare workers, my nurses, doctors, and everybody that's on the front lines, first responders, truck drivers, all the people who are at the food stores, the local McDonald's, and all these places that are open. These are all brave people going to work. The people who deliver pizza and all of the people who are keeping things going for us. I want to say a special thank you to each and every one of them. I am one of the frontline workers. I go to work every day. I'm in the security field. That's part of the necessary people that are working. I go to work every day and I'm out there taking the risk. So I do take the necessary precautions, but I want to say thank you to the brave people out there. So let's let this roll. I'll be back with you guys in a few minutes. I'm going to pause it. I'm not going to be talking during this 27-minute press conference, but I encourage all of my friends and all of my people to listen to this and watch this. This is very good information. Thank you, Marcy. I appreciate it. So I'm going to be silent during this, but I think it's important. There'll be a little picture of me. Where is it? It's going to be right here. There'll be a little picture of me right here, and I'll wave to you guys in acknowledgement, but I don't want you guys to not get this information. It's important, I think, that each and every one of you know about this. Thank you for your service, Mikey Mizor. Thank you, New York, Brooklyn, first responder. Keep us going. Much love and respect. And thank you, Gemma, for the super love. I appreciate the super love all the way from the UK. Great to see you. So again, I tip my cap to the first responders and everybody out there on the front lines. So let's let this video roll and we will go from here. Just let me know if the audio is good with a thumbs up.
To everyone. These are stressful, emotional times, as we know. And today is a day in the state of New York with very mixed emotions based on two very different pieces of information we have. I'm trying to work through the mixed emotions for myself, so I'll just present the facts and then we'll go from there. There is good news in what we're seeing, that what we have done and what we are doing is actually working and it's making a difference. We took dramatic actions in this state. New York Pause program that closed down schools, businesses, social distancing, and it's working. It is flattening the curve, and we see that again today. So far, meaning what? Meaning that curve is flattening because we are flattening the curve by what we are doing. If we stop what we are doing, you will see that curve change. That curve is purely a function of what we do day in and day out. But right now it's flattening. The number of patients hospitalized is down. And again, we don't look at just day-to-day data. You look at the 3-day trend, but that number is down. The 3-day average trend is also down. Anecdotally, the individual hospitals, the larger systems are reporting that some of them are actually releasing more people than are coming in, so they're net down. So we see the quote-unquote flattening of the curve. We have more capacity in the hospital system than ever before. So we've had more capacity in that system to absorb more people. The sharing of equipment, which has been really one of the beautiful, cooperative, generous acts among different partners in the healthcare system, has worked. If the hospitalization rate keeps decreasing the way it is now, then the system should stabilize over these next couple of weeks, which will minimize the need for overflow on the system that we have built in at Javits and at the USNS Comfort. So that is all good news. There's a big caution sign. That's if we continue doing what we're doing. If we continue doing what we're doing. We are flattening the curve because we are rigorous about social distancing, et cetera. So if we continue doing what we're doing, then we believe the curve will continue to flatten. But It's not a time to get complacent. It's not a time to do anything different than we have been doing. Remember what happened in Italy when the entire healthcare system became overrun? So we have to remain diligent. We have to remain disciplined going forward. But there's no doubt that we are now bending the curve, and there's no doubt that we can't stop doing what we're doing. That's the good news. The bad news isn't just bad. The bad news is actually terrible. Highest single-day death toll yet, 779 people. When you look at the numbers on the death toll, it has been going steadily up, and it reached a new height yesterday. The number of deaths, as a matter of fact, the number of deaths will continue to rise as those hospitalized for a longer period of time pass away. The longer you are on a ventilator, the less likely you will come off the ventilator. Dr. Fauci spoke to me about this, and he was 100% right. The quote-unquote lagging indicator between hospitalizations and deaths. The hospitalizations can start to drop. The deaths actually increase because the people who have been in the hospital for 11 days, 14 days, 17 days pass away. That's what we're seeing. Hospitalizations drop and the death toll rises. I understand the science of it. I understand the facts and the logic of it. But it is still incredibly difficult to deal with. Every number is a face, right? And that's been painfully obvious to me every day. But we have lost people, many of them frontline workers, many of them healthcare workers, many of them people who were doing the essential functions that we all needed for society to go on, and they were putting themselves at risk, and they knew they were. Many of them vulnerable people who this vicious predator of a virus targeted from day one. This virus attacked the vulnerable and attacked the weak. And it's our job as a society to protect those vulnerable. And that's what this has always been about from day one. And it still is about. Be responsible, not just for yourself, but to protect the vulnerable. Be responsible because the life you risk may not be your own. Those people who walk into an emergency room every day and put themselves at peril, don't make their situation worse. Don't infect yourself or infect someone else so their situation becomes more dangerous. Just to put a perspective on this, 9/11, which so many of us lived through in this state and in this nation, 2,753 lives lost. This crisis, we've lost 6,268 New Yorkers. I'm going to direct all flags to be flown at half-mast in honor of those who we have lost to this virus. Big question from everyone, from my daughters, I'm sure around most people's dinner table. When will things go back to the way they were? I don't think it's about going back. I don't think it's ever about going back. I think the question is always about going forward. And that's what we have to deal with here. It's about learning from what we've experienced, and it's about growing, and it's about moving forward. Well, when will we return to normal? I don't think we return to normal. I don't think we return to yesterday, where we were. I think if we're smart, we achieve a new normal. The way we are understanding a new normal when it comes to the economy and a new normal when it comes to the environment. Now we understand the new normal in terms of health and public health. And we have to learn just the way we've been learning about the new normal and other aspects of society. We have to learn what it means, global pandemic, how small the world has actually gotten. Someone sneezes in Asia today, you catch a cold tomorrow. Whatever happens in any country on this globe can get on an airplane and be here literally overnight. And understanding this phenomenon and having a new appreciation for it, how our public health system has to be prepared, and the scale to which we need a public health system. Look at the way we're scrambling right now to make this work. We have to learn from that. I think we've also learned positive lessons. We've found ways to use technology that we never explored before. You have a New York State court system that, thank you, Chief Judge, is basically developing a virtual online court system, which has all sorts of positive benefits going forward. Using technology for healthcare, using technology for work from home, using technology for education. I think these are all positives that we can learn. Testing capacity, which we still have to develop. That is going to be the bridge from where we are today to the new economy, in my opinion. It's going to be a testing-informed transition to the new economy, where people who have the antibodies, people who are negative, people who have been exposed and now are better, those are the people who can go to work, and you know who they are because you can do testing. But that we've all developed a sense of scale over the past few weeks in dealing with this. There's also lessons to be learned. Why are more African Americans and Latinos affected? We're seeing this around the country. Now, the numbers in New York are not as bad as the disparities we see in other places across the country, but there still are apparently disparities. Why? Well, comorbidity, I understand that, but I think there's something more to it. You know, it always seems that the poorest people pay the highest price. Why is that? Why is that? Whatever the situation is, natural disaster, Hurricane Katrina, the people standing on those rooftops were not rich white people. Why? Why is it that the poorest people always pay the highest price? But let's figure it out. Let's do the work. Let's do the research. Let's learn from this moment, and let's learn these lessons, and let's do it now. We're going to do more testing in minority communities, but not just testing for the virus. Let's actually get research and data that can inform us as to why are we having more people in minority communities, more people in certain neighborhoods. Why do they have higher rates of infection? I get the comorbidity. I get the underlying illness issue. But what else is at play? Are more public workers Latino and African American who don't have a choice, frankly, but to go out there every day and drive the bus and drive the train and show up for work and wind up subjecting themselves to, in this case, the virus, whereas many other people who had the option just absented themselves. They live in more dense communities, more urban environments. But what is it? And let's learn from that, and let's do it now. I'm going to ask our SUNY Albany Chief, Dr. Javidan Rodriguez, to head an effort to do it right now. We'll do more testing in minority communities now, with more data research done now. So let's learn now. Department of Health will be doing it along with Northwell. But let's learn these lessons now. We're also going to make an additional $600 payment to all unemployed New Yorkers. The federal government says they will reimburse us for it, but people need money now in their pocket. So New York will be doing that immediately. We're also extending the period covered by unemployment benefits for an additional 13 weeks, goes from 26 weeks to 39 weeks, so that should be a relief. On voting, I've seen lines of people on television voting in other states. This is totally nonsensical. God bless them for having such diligence for their civic duty that they would go stand on a line to vote, but people shouldn't have to make that choice. And where, by executive order, all New Yorkers can vote absentee on June 23rd, primaries coming up. I want to say thank you to the many places and people who are working with the state of New York. Mercury Medical donated 2,400 BiPAP machines. BiPAP machines are technically not ventilators, but they can be modified to effectively ventilate, even though they're not ventilators, and we're using them. They were brought up from Florida. Thank you very much, JetBlue, for doing that. I also want to thank Oregon and Washington State and California for freeing up ventilators. I want to thank the direct care workers who are doing a fantastic job, and they're doing it every day. I want to thank the state workers who are showing up and doing a great job every day, every first responder. This has been a long battle, and it's going to go on, but I want them to know how thankful we all are of them for what they're doing. I want people to remember that we're flattening that curve, and if anything, we double down now on our diligence. We're going to start a social media campaign. Who are you staying home for, right? It's not about staying home for yourself. Stay home for others. Stay home for the vulnerable people who, if they get this virus, are in a really bad place in life. Stay home for the healthcare worker who's in the emergency room because you don't want to infect anybody else, who then puts another greater load on our healthcare system. So who are you staying home for? I'm staying home for my mother, but everyone, it's not about just you, it's about all of us. So who are you staying home for? And we'll start a social media campaign that does that. But thank you to all the New Yorkers for all they've done. And we still have more to do. We are by no means out of the woods. And do not misread what you're seeing in that data and on those charts. That is a pure product of our actions and behavior. If we behave differently, you will see those numbers change. I just doubled the fine on disobeying the social distancing rules. Why? Because if anything, we have to get more diligent, not less diligent. And we have more to do. And that's New York tough. But tough is more than just tough. Tough is smart and disciplined and unified. And tough is loving. The toughest guys are tough enough to love, right? Last point, our brothers and sisters in the Jewish community celebrate Passover tonight. We wish them all a happy Passover. The Jewish community has had a long and difficult year besides any of this. The number of incidents of anti-Semitism across this country, the violence that they have seen, even in this state of New York that has such a large Jewish population. So we wish them all well on Passover. And the message of Passover, I know, helps me today, and I offer it to others to consider. Passover says we remember the past, we learn from the past, we remember the lessons of the past, we teach a new generation those lessons. But there's also a message of hope in Passover. Next year in Jerusalem, next year in Jerusalem, next year the Promised Land, next year will be better. And yes, this has been a difficult month. We'll learn a lot, we'll move forward, and we'll be better for it. Questions?
In New York City, 75% of frontline workers are Black and Latino.
All right, I'm just going to say one thing. That was a great briefing. Every day he does a great briefing. Welcoming everybody, but I have to keep us focused right here. I did a video about the Hasidic community coming out and standing around at a funeral for a rabbi who passed away from COVID-19. This governor right here, he knocks these speeches and these briefings out of the ballpark. But what he failed to do right there, and the only negative that I can bring from this, is that he did not directly address the Jewish community and ask them to please do not disregard social distancing rules. He could have used his huge platform that receives millions of views every day by sending a message, because they've been violating this. And if anything, this is the one thing that I would have said to Governor Cuomo that he missed. He missed it right there, because he could have nicely slipped that in as, hey, listen, happy Passover, but let's not see anybody out in droves or congregating together. I did a video about this, and this was an opportunity for him to nicely, again, and firmly state, we are not going to tolerate if you do this. If you do this, there's going to be consequences. So let's enjoy Passover, but also let's respect all the people that are around you and all the people you come into contact with. So that's all I'm saying. And I'm not saying all Jewish people break the rules. I'm saying that he could have been more forthright and more forthcoming with a direct message here. And that's all I'm saying, guys. I'm not trying to have an argument. I'm not trying to, here, the Passover message was great, and he spoke about the Jewish community and how rough a time they've had with anti-Semitism, and I am fully against that. I have many, many friends who are Jewish, who practice the Jewish faith, and they're wonderful people. But he needed to address a concern to his constituents and to his people throughout the state of New York who blatantly violate this. And the gatherings of 200 and 300 Hasidic Jews at a funeral, whether it's for a rabbi or for a fellow brother or sister, is unacceptable. And I think that's the only takeaway here, that I disagree with him. But you're going to hear some news reporters revisit it. So let's listen in to the end of this. It's gonna get revisited. Trust me. You got to love the media, because they're not going to let them off the hook.
We're talking about grocery store clerks, people who work in public transit, childcare. Is it time to scale back some of these grocery stores that are open, or some of these businesses that are still open at this point, to try to bridge that gap?
Yeah, the question is, many of the essential workers, public workforce, tends to be African American and Latino. I think that's probably right. I don't know the statistics, but I think that's probably right. I also believe the frontline workers do have a greater exposure than most people. I think that's one of the things we'll find when we do this research on why is the infection rate higher with the African American community and the Latino community. Again, the disparity.
Okay, again, guys, don't kill the messenger here, please. I have to just say this, because this is a very, very important thing. Why is it affecting African Americans, Hispanic, and people of less social means? The wealthy are not being hit as hard, and the more affluent communities. I'm all for this. This is something that needs to be visited. But what needs to be visited first and foremost is to have people on board with the social distancing, and the people that aren't doing it, just needs to be more consequences. So again, here he continues on about this, which is a very important thing. But I think which is more important is stopping 200 and 300 people from gathering at funerals and weddings randomly. you know, and that's all I'm saying. And I'm not downplaying what he's talking about here, because it is important. But right now, while we're in the middle of this fight, I don't think that, you know, I think that what he should be concentrating on is the people who are not like myself and my whole entire family. Everybody in my whole family is practicing and following the rules.
That we're seeing in New York is nothing like what you see in other places across the country. But I think it is something that we have to understand. I don't think we can reduce the essential services. You know, we're down to basically food, pharmacy, basic transportation, which frankly is more for our essential workers to get where they're going. If you didn't have public transportation, you couldn't have those healthcare workers showing up, you couldn't have the grocery workers showing up. So I don't think we're in a position to say eat less or use less drugs or use less healthcare. I think we have to get through this now and then learn from it and see what changes we can make in the future.
Do you think the state was slow?
Excuse me one second, Karen, just Bernadette.
Was the state slow to shut everything down? Did New York Pause come too late? Do you guys wish that you had started reducing the workforce, shutting down businesses, et cetera, sooner, especially considering San Francisco had shut down prior to New York? Do you think that New York was late to act?
No, I think New York was early, and I think the actions we took were more dramatic than most, and frankly, were criticized as being premature. So no, I think if you could rewind the tape, you'd have to go back to last November, December, what was going around, what was happening around the world, and what was the effect going to be here. My point about, you know, global pandemics, we're watching China, we're watching Italy, we're watching other countries. Well, extrapolate from that on a national basis. What was the first part of your question, Bernadette?
Just wondering if you think, you know, should you have shut down the schools? There's a conflict between the city schools, you know. De Blasio and you were having that debate over should we shut them down, also bars and restaurants. Should any of those actions come further?
You know, there wasn't a
instead of
debate.
Incremental?
There wasn't a debate. I made the decision to close down the city schools. I didn't have a debate. There was a debate about closing city schools, and people thought I closed the city schools prematurely. That was the ongoing debate. But no, I think, look, if anything, in retrospect, it shows what we did is right. I'm sorry, Karen.
I'm sorry. On the June 23rd voting, do you envision polling places being open? As you know, many of the poll workers are older workers, or would everybody be voting by mail at that point?
I think we're just saying absentee voting is an option. We don't say it's a necessity, right?
We're saying absentee
Sophia,
voting
thank
is
you
an
for the super
option.
chat.
We're saying that temporary
gonna
illness
fast forward
provision
this.
of the absentee voting will include the risk of contracting COVID.
Some of them are as a result of.
Or known clusters at nursing homes?
Well, we have seen in. So we are tracking the nursing home.
Peconic Landing and the community.
Saying that temporary
They're
illness
gonna ask about
provision of the
nursing homes
absentee
now.
voting will include the risk of contracting COVID-19, and I think we're going to take a wait-and-see approach as we get closer on whether or not any polls should be open.
Peconic Landing has been releasing COVID data to the public, but many other nursing homes aren't. Should all facilities do so?
Do you understand that question? Peconic Landing?
Peconic Landing and the community on Long Island that's seeing the high number, that's been seeing the high number of COVID
Peconic
cases.
Landing is a nursing home that has been releasing data. Should other nursing homes be releasing data, is the question? Should all nursing homes or any nursing homes?
So we are tracking the nursing homes, and we want to protect the privacy of the individuals in the nursing homes, and we do defer that back to the homes themselves. So that particular place has really more, but we
I've seen better numbers and models. I think what percent of the population would actual compliance on social distancing? You'll see those numbers. People read something into it that's
Okay, here we
not
go.
there.
Hold on. I'm going to pause this for a second. Sip some tea with Marie. I saw that you said you were on Top Chat. I do that all the time. Sip some tea with Marie. Thank you for the generous super chat. She says, thank you for being a calming force in YouTube. It's my pleasure. I'm glad to do it. And I think that there's no other way to do this. We need to get the message out. We need to make and keep each and every one of us educated with the proper information. And I think this is a good way to do it as a content creator. So I thank you for the accolades. I thank you for that, and everybody that sends me messages. Thank you for that. But I do this for the good of everybody. I don't just do this for myself. I do it for the good of all of us. So let me go. Let this go, because now they ask him about the social distancing problem.
If you reduce that compliance on social distancing, you'll in January. They all had a premise about how effective social distancing would be, what percent of the population would actually comply with social distancing, et cetera. And they have turned out to be wrong. But I think, Jesse, they can be wrong either way. I'm more worried about people saying, oh, well, the number of cases is coming down. It's now safer. It's not. It's not. I'm more afraid of the number changing and the curve changing because people read something into it that's not there. If you reduce that compliance on social distancing, you'll see those numbers go up within days. Literally go up within days. So no, I take it one day at a time, look at the data for the day, look at the numbers for the day, and then make a decision. Well, 2 weeks, look, we only went to April 29th, right, with the school closing. We extended everything until April 29th on the school closing, New York pause. Even that's a projection. I wouldn't go past that.
What about other areas of the state? We obviously see concentrations on Long Island, Stephen, downstate, and Hudson Valley, but there are other places where we haven't seen these cases. Do you foresee opening schools, opening non-
You haven't seen these cases yet, Jimmy, and be careful.
What sort of metric, what metric would you be looking at, or Dr. Zucker, or any of you, to make that sort of decision? What would be the...
There's Westchester, there's Rockland, right? So I stay very close to Governor Murphy and Governor, now, Broadway obviously is. You think there's ever going to be a morning that I wake up again in my life not worried about this in the back of my mind? You don't think we're all going to worry about now, is there a second wave? You don't think we're all going to worry about now when somebody sneezes
Welcome in, Hunter, and happy
Asia,
Passover
how long
to you and
until
your
that
entire family.
cold comes here? No, but I would not, zero, I don't know that we ever get back to zero. Doctor, you want to mention something?
I concur 100%.
They just asked him if he thinks we'll ever get back to normal. He said no.
Hospitals in Queens, that they don't have the blood gas machines or cartridges, which are critical for operating them. Also,
If you're young, you may have a different life expectancy. Low.
It sounds like if we're nearing the apex or at the plateau, whatever, what number do we have? What do we need these temporary facilities? What are the updates on those numbers? Both
Not full, Micah, you're right. We are, that's my whole point. We're flattening the curve now below projected peaks because of our behavior. But again, Jimmy, you want to talk about this in the retrospective. There is no retrospective. You're in the middle of it. If you walk in front of traffic on the way home, yes, you're young, you may have a different life expectancy based on your action. Nobody knows.
Are you worried about undercounting in terms of people that may have died at home and not been diagnosed with COVID-19?
I think that's a very real possibility.
And have you given any thought, or has anyone?
We're looking at other models of counting, but I don't know. No, I have no idea. The question is, if people died at home, might you not have those numbers because they would only come from basically a funeral home? we're looking at other models because right now, most of the data we have comes from hospitals and major institutions.
They had symptoms that would have been treatable, or it would have caused them to go to the hospital. So, you know, like it's confusing because if people are in the hospitals, right?
They're
They're
just
the hospitalization
talking about
rate is the number of people who
now.
walk.
The reporters today were insisting on harping about numbers. Okay, we all know that the numbers are definitely much higher. You know, the numbers are definitely much higher because of lack of testing, lack of data, lack of accountability with how many people were actually sick and corrected and went through the symptoms and survived and never reported because they couldn't report. So the numbers, you know, I don't really see any benefit to the reporters harping on that today. What we're talking about is record number of deaths in New York at almost 800 overnight, and 2,000 deaths throughout the United States overnight in a 24-hour period. That includes all 50 states. You know, those are sobering numbers. Those are sobering numbers. I'm gonna go off of this. So thank you to everyone. It's now dark outside. When I started this live stream, it was light. Welcome everyone who has just joined during the course of this. Katrina, thank you so much for being in here. Here comes the chat over the screen, which I don't like. Here comes the chat over the screen. I don't know why it's doing that, but it is doing it. So I'm going to go back to this because I don't like that. The chat over the screen is annoying to me. I don't know how many of you does that bother when the chat goes over the screen? Josh, we got to take care of that. I got to get that off. I don't know what's going on with Streamlabs and the chat coming across the screen like that, but it's annoying. But yes, all my Jewish friends, happy Passover. Hello to all my channel members who joined during the course of this news conference. Again, guys, it's Wednesday. I wanted to come live and give you an update of what's going on. It looks like we have flattened the curve, but that is by no means we're out of danger. We still need to continue with the practicing of social distancing. It is not something that you should take if you're here in the New York metropolitan area, to take that lightly and loosen up the your social distancing. Don't get a sense of that everything is okay. I think, I think that at the end of the day, folks, we need to continue forward with social distancing, continue with what's working. I think the real reason why we now see the curve starting to flatten is because we're socially distancing, and we need to do that. I'd rather see Dutyron's handsome mug. There you go. But I can't do it because the chat is just I don't know how to fix it. So at the end of it all, the reason why the numbers are starting to decline with the new hospitalizations is because the practicing of the social distancing, the practicing of sanitary hand washing, gloves, masks, all of those things are what keeps the these cases from the virus spreading. So at the end of the day, do not get a false sense of hope from this, a false sense of that everything's going to be okay. Now I could go out, I can go run around, I could do this, I could do that. We need to stay indoors. We need to minimize our public contact until further notice. So that's all I got for you guys. I appreciate each and every one of you. I thank you for joining in on this live stream. I encourage you to go and see valid websites like the cdc.gov, go to the World Health Organization website. I'll link it down below in the description. I really don't know how to correct this Streamlabs. Let me just see something. Hold on. Let me just try something here. Hold on. Maybe there's something in the settings here that I could do to stop this horror show. Hold on. Chat. Let me see if I could do this. Stream, output, video, hotkeys, advanced. I don't know, guys. Streamlabs has a mind of its own. And it's, I don't think I could change it. Can't do it. Oh, well. It's so annoying. So annoying. So I'll end the live stream on this. I'm going to go back down to the small screen because it is annoying and very, very not good. So I will talk to you guys on the next one. Thank you so much for joining, and I will see you guys on the next live stream. Love and respect from my house to yours. Everybody stay safe, social distancing, stay home, stop the spread. And I'll talk to you guys soon. God bless the world. God bless America. And God bless each and every one of you.